Now, I want to just, begin by turning back to this slide that I used to talk a lot about 2 or 3 months ago, back when we are between the second and third waves. And back then, there's a, this was a slide from the science table, but the key point is that they were showing that likely we would see our non-variant cases go down. We would see our variant cases going up in the background. It looked like our cases are going down for a while the total number of variant cases weren't very large, but bubbling under those variants would be growing. And eventually they would supersede the number of non-variant cases. We would start to see the overall case trend head upwards, and we would get into another wave. And unfortunately, that's exactly what happened. And you can kind of see what would happen with our cases where, this is the overall case numbers are going down, but you could see the variants are coming up. At some point, the orange bar is larger than the blue bar, meaning that there are more variants than non-variants. And at that point, you start to see that the orange trend is basically overwhelming the blue trend. And away we went, unfortunately, with that second wave. And the big concern I think we have right now is, from what we've seen in the United Kingdom and elsewhere, is that they've basically seen this pattern repeat itself, but instead of being non-variants and variants, they've seen it with the alpha variant coming down, but the Delta variant growing in the background. And in the UK, if we take a look at what's happened there, where now over 90% of their cases are this purple color, which is the Delta variant, that is really overwhelmed what's going on there. And this is a slide I showed a couple of weeks ago, showing in various communities of the UK where you have this kind of gray line, which is coming down, which is the non-variant cases, or sorry, the alpha variant cases. But you had this red line, which is the Delta variant cases. And as the alpha variant comes down, the Delta variant was bubbling up in the background and eventually takes off. And what the UK has unfortunately seen is that if we take a look at their case curve there, they are very much now into a new wave of infections because that Delta variant is basically all of their cases. And while for a while it looked like the cases were coming down, that was because they were seeing only half of the trend. They were seeing the effect of the alpha variant coming down, but not the Delta variant growing. And once that Delta variant took off, you can see what's happened there. And just a reminder that the UK's vaccination rates are a little better than Canada's. First dose is pretty much the same. They're about 65% of the population is vaccinated with one dose. But with second doses, they're closer to 50%, whereas in Canada, we're more in the 35 to 40% range. And so I think the UK story is very illustrative for us. To show you one other country here, which is Israel, which likewise has recently seen the Delta variant taking off. This is what their case curve looks like. Israel is actually really close to 0 cases, you can see here. And this is actually a 10-fold increase over the last 2.5 weeks or so in terms of their cases. Fortunately, they started at a very low number, so that 10-fold increase is not in a very high yet in an absolute number. But you can imagine if this keeps going for a few more weeks, it's going to look like another wave for them. And again, Israel, really the world leader in terms of vaccination, has similar first dose coverage to us in Canada, 65%. Probably is actually closer to 60% of people who have 2 doses, so much better than we are here. Just showing you in the United Kingdom, this was an ICU physician in the United Kingdom here talking about how they're now seeing hospitalizations show up again, which of course is expected. If cases go up, you're going to see more hospitalizations. And finally, I just want to quickly talk about what we're seeing south of the border in the United States. And so this blue bar here is the alpha variant, the red bar is the Delta variant. And you can see aren't absolute cases, this is a percentage cases. You can see the US, their alpha variant cases as a percent is going down, but their Delta variant cases are taking off, and probably about 70% of their cases are now the Delta variant. And if we take a look at what that has looked like in terms of the case curves in the US, you can see here where that gray bar was coming down in many states, and that red bar, which is Delta, has been going up. And you can see as of the most recent weeks in some of these states, that red part has now overwhelmed the gray part, and we're seeing cases start to rise again. Fortunately for us, if we look across the river in New York State, it's not quite as bad yet, but certainly in some other places there are. There's been some news stories about how Missouri is once again seeing their hospitals overwhelmed. This is a look, across many different US states, and you can see a lot of US states have a very high proportion of their cases are now the Delta variant. And even in a place where New York State, where it doesn't look too bad, 65% of their cases are the Delta variant. Fortunately for the US so far, they haven't seen much of an increase in cases yet. There's probably been about a 10 to 20% increase over the last couple of weeks, but you can see very much they've flattened out. There's a very slight increase starting, and I think they might be on that part of the curve where might see this start to pick up as the Delta variant grows more and more. And I highlight all of this of what's happening in the UK, in Israel, in the US, just as sort of the warning signs for us of what could take place here as well. Because of course the Delta variant is in Canada and in Ontario as well, and it's growing. And these are previews of where things could end up for us longer term if we're not careful. Okay, so let's take a look now at what the case curve looks like in Ontario. And so far, it's looking pretty good. We can see cases have come down. It's not declining as quickly, but it's definitely still seeming to go down. So we aren't as far along as the US or definitely not as far along as the UK or as Israel are in terms of the Delta variant starting to take over and overwhelm the trend here in Ontario. We can see from the reproductive number here that cases, the reproductive number remains well below 1.0, meaning that we still are seeing a downwards trend in cases, which is absolutely good news. Good news as well when it comes to hospitalizations, as well as persons in the ICU, with that coming down. And we're finally past the point where ICU numbers are actually below where they were between the second and third wave. And so we're starting to get closer to below that 150 threshold that the province had. But once we take a look at the variants here, this orange bar here more recently is basically cases where we can't definitively identify a variant, which probably means the Delta variant, versus the yellow is all other variants, mostly Alpha variant. And you can see that the proportion of Ontario's cases, which are the Delta variant, is starting to become the majority. It's near 70% now is probably the Delta variant. And so we're definitely seeing that trend shift similar to what we saw in other countries before they start to see their cases increase. This is a reproductive number for the Ontario, actually broken out by the Delta variant versus the non-Delta variant effectively. And you can see with non-Delta variant, we've very successfully kept that the reproductive number well below 1, really since we went into our lockdown in early April. You can see with the Delta variant, we have struggled to keep that reproductive number under 1. It goes a little bit above 1, we managed to get a bit below 1, it goes up and down. It's sort of hovering around that 1.0 mark. And of course, the 1.0 mark would mean that you'd see cases stay relatively flat. And if we actually look at our case trend here, you can see this orange line representing the Delta variant is pretty much flat right now. Those cases are staying flat. And if we're able to keep it flat, I think that's good news. That means we don't see that increase. But the proportion of our cases which are the Delta variant are going to keep growing, which is going to put an upwards pressure on this. Pushing back against that rising is, of course, as we get more and more people vaccinated, we're going to be pushing it down. And it looks like over the last month, we've been successful that we've been getting vaccinations out quickly enough that we haven't let that Delta variant curve start to spike up, but we've been able to keep it flat. And that's really, I think, going to be the key thing as we move forward, that as we go through step 2, hopefully step 3 as well, we continue to have enough happening with vaccinations, enough happening with all the other things we're doing to control COVID-19, that we're able to keep this Delta variant curve no more than flat. It hopefully could even go down, but if at least it's staying flat, we're not going to be in a situation where the cases could start to rise. If that isn't quite successful enough and we start to see this going up, I think we could be in a danger situation similar to other countries, and we would want to make sure we act really rapidly to kind of stop that. Switching over to the Niagara story, it's maybe not quite as optimistic here in Niagara. So we've seen our cases coming down. It has almost flattened out here. We're still declining very slowly here in Niagara, but we're not seeing quite as much of a decline as the province as a whole is seeing. And that's really evident when we look at the reproductive number, where Our reproductive number is now hovering around the 1.0 mark. We've actually generally stayed below it. I think there's only one day we were actually at or above the 1.0 mark, but we are very close to it now. And we weren't able to do an analysis breaking out Delta variant versus non-Delta variant, but I imagine that Delta variant is consistently above 1, non-Delta variant is below 1, and the combination of those is giving us this curve that's sitting just around the 1.0 mark. Some good news with hospitalizations and people in ICUs. You can see these curves have come way down, and the ICU number is, I think, at 1 now. It's almost nobody left with COVID-19 in our ICUs. And the hospitalization number is, I think, down to 4. So that's some very good news here in terms of what's going on. And then when it comes to Niagara cases detected as variant of concerns, you can see that number has dropped off quite sharply, and the ones we can't detect are presumably the Delta variant. And so you can see it's quite a large number. It's probably 70–80%, similar to the province. The one thing I would say is that we are seeing there's a bit of data lag. So this is showing even the last week of June. And we are seeing that in previous days, some of these oldest numbers actually get revised upwards. So I'm a little optimistic it's not quite as low as this, but I do think that we probably are seeing this number probably in the 30 to 50 range. And so we probably have close to half of our cases at this point are the Delta variant here in Niagara. This is some data put out, or some slide put out by the Public Health Agency in Canada, just emphasizing it. Of course, the Delta variant spreads more easily, it's more transmissible. It's about 50% more transmissible than the Alpha variant, which itself was about 50% more transmissible than the previous versions of COVID-19 we had back in the fall and early winter. And so we're probably dealing with a version of COVID-19 that's actually twice as hard to control and spreads twice as easily as we were maybe 6 or 7 months ago. It's looking more and more likely that the Delta variant is more severe, about 50% more likely to be hospitalized with it. Good news is that vaccines still work, but the key thing is that we need 2 doses of vaccines for it to be really effective. And the Public Health Agency of Canada has shown that as a Canadian-wide trend, we're currently on track to come down. But if we increase the number of contacts we have with others in society by too much, we could get onto this trajectory where we see cases come back up. If we only increase it by about 25%, we could still maintain a downwards trend. And of course, as we reopen, we allow gatherings, we allow people to be dining in larger numbers in restaurants, we allow people to partake in more social activities. There's going to be more social contact with people, and we will end up on one of these trends. And hopefully it's going to be the blue one rather than the orange one. I think, of course, if we're going on this orange trend, eventually we want to get to a point where we can reopen everything. And our hope is here that we're going to have enough vaccination out that we're able to do that. And the Public Health Agency of Canada a couple of weeks put out some data on this. They say that if we didn't have Delta variant, this dotted red line is our hospitalization, total number of hospitalizations we could absorb. And the black line is how many people are currently hospitalized. You can see if we completely reopened right now and we didn't have any Delta variant, we would actually be fine, and our hospitalizations wouldn't actually overwhelm our system. Our vaccination rates right now, looks something like this. Orange bars are 2 doses, blue bars are those who only have 1 dose, and then the light orange are people who are booked in for a first dose. You can see we're getting these second dose numbers up very high, especially amongst our elderly age groups. Overall, we now have more people who are vaccinated with their second dose than are vaccinated with a first dose. So we've crossed that 50% line, and hopefully we'll continue to drive that number up quickly. Lots of room here, though, and for a younger group still to get their first dose. And of course, they're the most recently eligible for second doses. So those numbers aren't quite as high here. But if you add this total number up here at the top of eligible people who are vaccinated, we're about 75.5% of our residents who can get vaccinated have been vaccinated. And so just to shift back over to what the Public Health Agency of Canada was showing here, where if we didn't have any Delta variant, we would be fine to completely reopen. Given that we do have the Delta variant, if we did reopen, we would see a spike in hospitalizations come up and come to the point where it could potentially exceed that threshold of how many hospitalizations that we could absorb. And they've then come up with this scenario here, which shows that if we are able to get over 80% of our population, of our eligible population, sorry, vaccinated with 2 doses, we get to the point where we can reopen and we don't see that spike in hospitalizations. And so I showed you in Niagara, we have 75.5% of people vaccinated with at least 1 dose. Hopefully we get everybody back for that 2nd dose. We need to get that 75.5% up to just over 80% and get them all with their 2nd dose. And then we're in the home clear where it looks like we'll be able to reopen without overwhelming our hospital system. And if we're taking a look at, where we're going to get those doses, that adds up to about 30 to 35,000 people we need to additionally get vaccinated. Obviously, the most room for improvement here is in our younger age groups. And actually, if you look at the 18 to 29 age group, this 12 to 17, there's only about 14,000 more people in that age group who could be vaccinated. The 30 to 39 is about 16,000 more people. There's about 32,000 people in the 18 to 29 year age group who are still unvaccinated. And so probably that is going to be the area where we are really going to make or break our potential to avoid a 4th wave and really bring COVID-19 definitively under control, is really getting a vaccination rate up in the 18 to 29 age group. And actually, if we take a look at where our cases are by age group right now in Niagara here, you'll notice something where, this yellow group, the 20 to 39 age group, remains the age group where we see the most cases, and they haven't come down similar to other age groups. And so I think that really reinforces again that is, an age group where we're seeing the most spread that's probably driving our ongoing cases. And if we can get more vaccines into that age group, we can actually hopefully get our cases much lower. And of course, looking at the UK data, we can see that 20 to 29 age group is really where we see the most of the Delta variant spreading as well. And so I think going forward, that's going to be our big focus, is to try and get that younger group vaccinated. Because if we get that group vaccinated, we drive down our cases. We probably actually drive down our risk from Delta variant as well. And we get to an overall population level of vaccination where we're not at risk of seeing another wave, and we can actually start to definitively reopen. And so, I think the key message for me is that there's a lot of warning signs about the Delta variant, but there's also this huge opportunity. If we can get this group here vaccinated, and we get, our overall vaccination rate for eligible people up over 80%, which is not that much higher than where we are potentially tracking towards, we actually have the opportunity to avoid that kind of wave that the UK and Israel are seeing and that the US might be heading towards. And so it's all about making sure we find a way to convince these younger people to be vaccinated. And that is going to be a key topic, I think, for us at the Community COVID-19 Vaccination Task Force. And it's going to be really, I think, one of our top priorities going forward. And with that, I'll turn it over for questions.
All right, thanks, Dr. Hergy. So up first for questions this week, we have Paul Forsyth. So Paul, you should be able to unmute now.
Can you hear me?
Yeah.
Yeah.
Oh, good, thank you. Dr. Hergy, is there a tipping point, do you think, that, did you have a prediction that will it be weeks when we reach the point when we have enough of these young people vaccinated that we can avoid the Delta, the dreaded 4th wave kind of thing that the UK is seeing? Do you have a kind of a rough prediction, or is it difficult to say when we can get these younger people the shots in?
Yeah, it's difficult to say. I don't think it's going to be too soon. I'd say the most optimistic timeline would be end of summer, sort of, end of August. Perhaps less optimistic timeline is we might be pushing into September and October. And I think, the key part is that if we're still at risk of a wave that late, we really probably need to be very cautious about our reopening for at least that long. And we're not going to be able to open the borders with the US, really return entirely to normal in a few weeks. I think we're going to have to keep going slow and steady with our reopening to make sure we, buy ourselves enough time to get those vaccinations out and not have that wave before we can get vaccinations high enough.
And a follow-up, Paul?
And related to that, you did mention this a minute ago about the border. There was a press conference this morning in Niagara Falls where the mayor and other officials were really pushing the federal government for, well, transparency, but basically saying get this border open as soon as we can. You would obviously urge some caution on that, right?
Yeah, I absolutely would. And, I started off by showing you some of what we're seeing in the United States where the Delta variant is taking off. Opening the border, I think, invites that we could have the Delta variant spilling over from the US into Canada. And we've, I think, fought really hard and, made a lot of sacrifices over the last few months with the another lockdown, our slow reopening right now so that we can keep Delta variant under control and not see waves such as other countries are seeing, and have the opportunity that we could vaccinate our way to a point where we're no longer at risk of a wave. And I think if we reopen the border with the US too early, we create the risk that Delta variant spills over here, and we actually lose all those gains that we've fought so hard to make, and we lose that opportunity to get vaccinations to that high level. I think we're gonna, the border is gonna open up in the next few months. I don't think it's too far off. I think we'll soon be at the point where we can do it, but we shouldn't rush to do it in a few weeks when a few months will mean we can do it in a way that's safe and sustainable.
Thanks, Paul. Up next, we have Alan Benner.
Okay, hi. The press conference this morning from the tourism people was also talking about reopening the casino, and wondered if there's potential of seeing that open safely at this point.
Yeah, I think that's really a decision for the provincial government. The province is opening up things that are more important and essential in society and deferring those that are less important. And I think they've decided that a casino is not an essential service in our society. And so we want to reopen, all the things that are more important to people, such as, getting haircuts and, being able to dine out. And the casino will probably come at a later point. I think there's probably some opportunity that you could open a casino in a partial way. Our casinos are in some ways just sort of glorified malls if you take out the gambling floor. There's probably some opportunity to at least have some level of reopening for those. And so, I think there's probably a way to get there, but it's really in the province's court. They're making decisions on this.
Excellent, thanks. Okay, and despite assurances, and we've heard them repeatedly about Moderna and Pfizer being identical, to brands of water, are you still seeing people that are opting to wait for Pfizer for fear of Moderna, or?
We've seen a small number of people for sure delaying their vaccination appointment for a second dose, particularly, so that they can get a Pfizer vaccine. By and large, I would say we're not seeing people declining their dose, but there's definitely a lot of questions, a lot of concern, and there's a lot of messaging and education that we need to be providing in our clinics to help people understand what the situation is with these two and how it really doesn't matter which product you get. The important thing is you get one of them to make sure you have those 2 doses of protection.
Okay, thanks, Alan. Up next, we have Penny Coles.
Hi, Dr. Hergy, you were very clear about the age group where the cases are highest. Have you had any opportunity to look at the cause in those age groups? What's causing the outbreaks? You talked about Section 22 being reinstated if you felt that it was from people dining in restaurants and that kind of social activity. Is it too early to say?
It's probably too early to say what the impact of lifting that provision of the Section 22 order is. That's only, just under 2 weeks ago that we did it. It, typically takes 2 weeks before you start to see the effect and 3 weeks before you've seen the full effect. Fortunately, so far, we're not seeing any real cases from people dining out. So thus far, that's not really a concern to us. Where we're seeing most cases occurring is really people having, social gatherings, visiting with friends, visiting with families, often actually visiting indoors where it's of greater risk, and that's allowing infection to spread. And then that person who's now newly infected goes back to their home and spreads the infection, unfortunately, to anybody else in their household, whether they're roommates, their family members, whether they're, in-laws or, grandparents. That's how it seems to spread. So you have a social gathering which spreads infection to multiple people, And then those multiple people fan out to their various households, and it spreads further within those households. And that's social, personal gatherings of meeting up with family, meeting up with friends. That's really seeming to be what is at the center of allowing the spread to occur right now.
And a follow-up question, Penny?
No, thanks, that's good.
Okay, great. Thanks, Penny. Up next, we have Don Mitchell. You should be able to unmute now.
Yeah, thank you, Dr. Hirji, for taking my question. So you kind of gave us this assessment on how Niagara's vaccination program is going and case rates and that sort of thing. Kind of wanted to just get your comment on, do you think things are going where they should? Have we hit a plateau? Are things slowing down? Obviously, you have a concern with 20 to 29 age group. Can you discuss a little more about what the big actions will be outside of, obviously getting people 20 to 29 vaccinated?
Yeah, I think it's a bit of a mixed bag in the vaccination story. The good news is that we are filling up any appointments for vaccines we have pretty much as quickly as we release them. Vaccine appointments are really filled up 10 days to 2 weeks in advance. We're seeing lots of enthusiasm by people who got the first dose to come back and get that second dose. And in spite of some uncertainty around the interchangeability of Pfizer and Moderna, where right now we're in a situation where there's a lot of Moderna and not as much Pfizer, we are managing to work through that, and we are still seeing people ultimately getting vaccinated. And we saw some really big numbers of daily vaccinations because there's actually been a bit of a flood of Moderna lately coming into Canada. And so whether it's us in public health, Niagara Health at the Seymour Hanna Clinic, primary care pharmacies, we've actually been able to start delivering more vaccines and actually speed up our rollout a little bit. The not so good news, I think, is that we have seeming to plateaued with their first doses. If you remember the graph I showed, there's only a tiny little, light orange bar at the end of there with additional people signed up for a first dose. We are still seeing, a couple hundred people getting a first dose every day, but it's not really large numbers. Overwhelmingly, people are getting their second dose of the vaccine now. And particularly, our first dose numbers aren't that high in the younger age group. And so that plateau has really impacted getting to a nice high level of coverage amongst them. One thing I wonder a little bit is that we know young people are often more spur of the moment people. They've grown up in the generation of social media where everything is, a 140 character message. You send it instantly. You want to buy something, you go online, you buy it, you're done. You don't really wait around. And I'm wondering if just that, big lag I talked about where it's, appointments aren't available in the next 10 days to 2 weeks is perhaps a deterrent to some of those young people. And as we get more of the people vaccinated with second doses and we shorten that gap, maybe we'll start to see more uptake amongst that younger group. But I think we also need to do a lot more to understand why that group isn't being vaccinated. Partly, it might be some just be the motivation and the push, and we need to figure out how we give it to them. Partly, we need to figure out, are there some concerns or some reasons people are choosing not to be vaccinated? And how can we address those and help people to make the choice to choose to get vaccinated? And those are some of the things that I think we need to be doing at our community task force to try and figure out what are some of those reasons, who are the many different stakeholders who do have connections and do have credibility with that younger age group, and how do we use those stakeholders then to influence them?
Okay,
And a follow-up question, Don?
Sure, yeah. My follow-up would be just in terms of messaging travel from other regions and not necessarily talking about the US border. I'm talking about, obviously Niagara is probably going to be, well, the mayor went out today and said what he said. And obviously Niagara with the great weather is going to be probably a target for a lot of people to come in now that we're into step 2 and they feel a little more comfortable moving from place to place. So can you just give me some concerns what that's going to be for you in terms of trying to manage your job, with a potential influx of people coming in and casinos opening and that sort of thing?
Yeah, we talked a lot in past months about mobility, and the province has talked about this as well, where particularly of people traveling from an area of higher cases to an area of lower cases can bring infection to that area and cause them to increase. And actually, this is something we've seen over the past 9 months, where whenever Peel regions saw their cases go up, probably a couple of weeks later, we saw our cases go up. We saw more recently variants go up in places like Peel, Halton, and Hamilton. And a few weeks after that, we're now seeing the Delta variant go up in our region as well. And that's probably because there's a lot of travel between regions, and that's driving some of that spread. For me, the stay-at-home order is gone, so it is permitted to go do that. But I think people should always be mindful of the risk that the more contacts you have, the more social people you're socially interacting with, the more risk you have to yourself of getting infected, and the more risk you have that infection could spread around. And if you're traveling between regions of the province, more risk that infection could travel around different regions of the province. With an influx of people potentially coming to Niagara, I guess the partial good news here is that Toronto and Peel actually on a per capita basis are pretty similar, if not actually a touch lower than us now in terms of their cases. And so the risk isn't so great if we have people from the GTA coming in to visit us, because they're no longer hotspots in that same way. They are a bit more of hotspots though to bring the Delta variant. So that's, I think, where more of the concern is. And then looking at a region like Waterloo, which is a major Delta hotspot and remains the hotspot for cases in Ontario, that people traveling from there could actually bring more cases and the Delta variant as well. And so I see it particularly as a risk that we could see the Delta variant get even more of a foothold here in Niagara with some mobility, and would caution everybody to be mindful of the reasons for your travel. Try to limit your travel to things that are truly important to make sure you limit the ability for infection to spread, and make sure that you stay safe and your family stays safe. And of course, get 2 doses of vaccine. So if you are traveling around, you're as best protected as possible.
Okay, thanks everyone. We've done a full round of questions. If anyone would like to ask one more follow-up, please let me know in the chat and I will unmute you. Okay, looks like that's it for today. So thank you, everyone. If you do think of another question, please send an email and we'll do our best to get that answered for you. And we will see you again in 2 weeks. Thanks.